Community-oriented counseling emphasizes the necessity for recognizing and dealing with environmental conditions that often create problems for ethnically diverse client groups. So sometimes, as a counselor, you might have to take on some alternative roles. One role might be as an advocate. This is when counselors are willing to speak on the client's behalf or to argue for a cause. You may need to be a change agent. Counselors assist clients in recognizing oppressive forces in the community as a source of their problem. They also teach clients strategies for dealing with these environmental problems. You might have to be a consultant. Counselors encourage clients from diverse cultures to learn skills that they can use to interact successfully with various forces within their community. The counselor and client work together to address unhealthy forces within the community. You will be an advisor. Counselor initiates discussion with clients about ways to deal with environmental problems that contribute to their personal problems. An example of this might be immigrants that may need advice on immigration paperwork, things like that. You may need to be a facilitator of indigenous support systems. Community workers need to be aware of cultural factors that may be instrumental in contributing to a client's problems, or resources that may help alleviate or solve the problem. Lastly, you might need to be a facilitator of indigenous healing systems. The counselors need to learn what kinds of healing resources exist within a client's culture, traditional healers, religious leaders, and then work collaboratively with them when it benefits the client. The goal of the community approach is to educate the public and attempt to change the attitudes of the community about mental health and attitudes towards those who deliver mental health services. One way community workers can initiate change is by organizing within an agency or even several agencies and developing a collective voice. Effective community workers encourage community members to discover their own strengths and to build on these resources. So, what kind of approach might you be interested in taking? A developmental or a service approach? A developmental approach is grounded on strengths, focuses on assets and capacities, and promotes capability and power, changes conditions, and is aimed at prevention. This approach builds on identifying resources within the individual, the group, or the community that can be more fully activated. The service approach focuses on problems to be solved and holes to fill. So it's concerned more with maintaining rather than changing conditions, and is oriented towards fixing problems rather than preventing them. Many professionals struggle with the issue on how to work within a system while retaining their integrity and vitality. Focusing on the things that can be changed fosters a sense of personal power that may allow for progress. So you as a professional can gain satisfaction by actively taking steps to promote positive change. You can do this by changing your perception by identifying the situation as acceptable. You can leave the situation, either emotionally or physically. You can recognize the situation as unacceptable and then decide to adjust to the situation. Or identify the situation as unacceptable and do what you can do to change it. So again, this is a way to maintain your integrity and in an agency environment. Workers alone would have difficulty changing large organizations, but when they unite, they have a greater opportunity for effecting change. When you're trying to be an advocate and work in the system, sometimes you walk a fine line when trying to support causes of equity, justice, and fairness while still keeping your jobs. We've talked about some ethical dilemmas this semester where those kinds of situations have come up. Counselors need to acquire the knowledge and skills to balance the institutional realities of working within systems such as managed care, who may want to discharge a client before they're ready to go, and ethically how you may have problems with that. And then your ethical and moral responsibility to advocate for social justice for your clients. As social justice counselors, we cannot preach social justice values in our work setting unless we're willing to practice what we teach. As mental health professionals, you may need to decide how you're going to work within a system and how you can be most effective. One of the things that you might want to do is study the agency's philosophies before even accepting a position and determine if the agency values and expectations coincide with what you expect from the position. If you're not able to support the philosophy and policies of that agency, you are almost certainly going to experience conflicts, if not failure. As professionals, we're expected to translate our awareness of inequities and societal conditions into various forms of social action. Part of our ethical and moral obligation is to advocate with the goal of creating a just society in which all people have equal opportunities and resources to strive towards their personal goals. The primary focus of this chapter has been the importance of working in the community as a change agent. This chapter challenges you to think of ways to accept the responsibilities of working effectively in an organization and thus increasing your effectiveness as a professional.